last slide. Jason has some thoughts that we can bat around as far as bringing this to a close. How do we use all this? What might be the charge for the Arthritis Foundation? How can they help us in this area? What is the role the Arthritis Foundation has to play in this whole area of biologics broadly, which is a very broad and emerging field? Nick, what are your thoughts? I mean, should the Arthritis Foundation simply be a vehicle for disseminating information to our patients? Should they have a role in warning patients about the often indiscriminate use and aggressive marketing that we all know is out there? It's, how does the Arthritis Foundation tackle that area? Are they simply an educating body? Do they help to organize clinical trials? Any thoughts?
And Scott, I'm not so sure that Jason was expecting to get that question directed at him. I was thinking he was expecting us to answer that question.
No, I think he is. I'm asking us to answer it. Yep. No, I think it's from the Arthritis Foundation to us, and frankly, it's really unanswerable. But we can make some suggestions for you guys, Jason.
Yeah.
Please send money.
I mean,
that's interesting. So, Nicolas, your thoughts from your getting your experience in the clinic there.
The only thing I would say, and I value, I mean, this is a great example of one of the potential roles, right? It's bringing people together from different backgrounds, from different parts of the field. And I think that just setting that ground and that table so that we can meet and gather, I think it's a great first step, right? Because you're getting all the players who can actually inflict change and build a better future. So I think that we are always in the search for funding. I think that you're going to need like sources like the Arthritis Foundation to think outside of the box to try to play in and start determining what are the next steps in funding and in bringing people together so that we can design things that have not been done yet. And I think that space it's quite unique and they're posed to do something very, very meaningful. And very relevant as well is the footprint that they have with our patients, which they play a key part of it. So it's not only in the education, but you have everybody from the patient to the physicians to the people who provide the funding all together sitting at the same table. And that's quite unique.
One point I'll make is something I'm sure my clinical colleagues shares. Patients all the time come in and they want, they've read all advertisements on the internet and on the New York subways about stem cells and all the indiscriminate marketing and aggressive marketing. And a challenge is educating our patients. And we can spend many hours in clinic each week trying to educate our patients and try to take a balanced view to point out the potential of these therapies, but the fact that we need more information. Anyway, the Arthritis Foundation being such an important advocacy group with in contact with or with influence with thousands and thousands of patients, I think the Arthritis Foundation can have a role in educating our patients and on the potentials, but the perils, if you will, in this whole area. So I would advocate that the Arthritis Foundation can advocate for this area or can help us as an education body for our patients. Chris, Joe, any thoughts on, do you see patients that come in with unrealistic expectations from aggressive marketing, where these treatments are being suggested for probably implausible conditions, inappropriate?
Yeah, there are many patients, and actually the really large volume of patients go abroad, so like Japan and China, who can actually in that country, the Korean companies make sales for Korean people. And so I think for one of, I don't know what the Arthritis Foundation exactly is, but I think one of the things this kind of non-profit organization is to share the data and implication and important things to not only to patients but to doctors, because they have doctors do not harm patients both intentionally or unintentionally. It's better and easier, I think, as well as we doctors will swear Hippocratic oath and sympathy for patients. So I think it's very important to educate doctors, much more important than the educate patients. And one more thing is to, I think it is necessary to see the cell therapy as not to see cell therapy as advanced therapy, as we've always performed advanced therapy as the state of art, as the state of art is the inherent nature of medicine. You know, all know the DMSO and steroid was also advanced therapy only decades ago. So the term advanced seems too fancy for naive patients, so should be carefully used even if it's already advanced in RMed. So not focusing on advanced, but on regenerative medicine would be the one way to that Arthritis Foundation.
It's a good point about educating physicians in addition to our patients.